Welcome back to Virginia This Morning.
This Partners in Healthcare segment is sponsored by WellAWARE Systems. Staying well and staying aware of your health, WellAWARE Systems puts you and caregivers in the position for a better quality of life and efficiency of care, too. Jeff Noche joins us this morning. Thanks for coming in.
Thank you for having me.
We were chatting a little bit before we were on about what WellAWARE Systems is. Tell us.
Sure. So WellAWARE Systems was developed at the University of Virginia's Medical Automation Research Center, and it's actually a type of technology that you experience every single day already. It works very much like the passive sensors that are on your car engine that monitor some key quality indicators there, and then when something goes off norm, a dashboard light comes on to let you know that something's wrong, with the whole idea of being preventive and trying to prevent a more systemic failure of your car's engine. Well, this type of technology was actually developed out of UVA to actually work with seniors so that they can use passive technology to establish baseline norms for them and then allow caregivers who are watching out for them to be early identified when there's something that is off norm, so that the whole idea is to be preventative as opposed to having a reactive care delivery model.
I always thought that that would be a great idea, to be able to have an idea. Sometimes you feel like you're having a good day, but are you really in terms of the numbers?
Sure. And so what we're looking for is more on a trending perspective, not necessarily looking at individual days or individual events, but most conditions, whether they be chronic conditions or an infection, actually develop over a period of time. And unfortunately what happens, because seniors don't self-report generally, or caregivers may not always pick up on the subtle changes that happen that are small changes, our system helps provide an objective look at that person's life so that we can capture those conditions very early on in the process. Allow the senior to age in place as long as possible, save the healthcare system dollars, and for everyone to be more proactive with it.
What kind of setting would the systems be utilized in?
So they're generally used by professional care providers. So it could be in an institutional setting, if you will, in an independent living, assisted living, memory care, skilled nursing environment. But it's also used in home health environments as well. We use the technology to actually allow the professional caregiver to, it's not a replacement for care, it's to be used in combination with their day-to-day care activities to make them work smarter, not harder, and everyone benefits.
Because when you're looking at those numbers and you see some sort of an anomaly, compared to your baseline measurement, then, we might have something brewing here.
Correct.
Yeah, and
correct.
That's nice to be able to afford that latitude to age in place.
Absolutely correct. And again, because seniors either don't self-report or maybe they suffer from memory impairment issues like Alzheimer's disease and they can't self-report, this is the way just to provide some insight. It's not like having someone there 24 hours a day, one-on-one, and it doesn't involve cameras or microphones, but it's a directional guide, much like a GPS system, to kind of help get to the end result much more quickly.
Fantastic. Now, this isn't something that I would go in or a senior would go into a store and purchase. This is something that you would request?
That is correct. It's a tool for caregivers to use, again, that works in combination of their day-to-day knowledge in combination with the information that comes out with the technology system that makes just the whole care delivery process more efficient, a higher quality. It's not a replacement for hands-on care, but someone does need to be there actually looking at the data to do some interventions when necessary. How
would a person go about then making sure that this is available?
What they would want to do would actually be to contact their professional care provider. If their mom or dad or loved one is utilizing a home care agency, is to speak with a home care agency about that and ask them to contact us, or someone that is a assisted living provider to have that organization contact us as well, and then we can put the system in place. And
I would imagine that caregivers as well really benefit from this, because it does give you that monitored perspective.
Absolutely. And it's giving them insight that they've never had before. And when you have additional insight on someone's health, let's say sleeping patterns, and sleep quality is huge with seniors, and to be able to know that something is off norm and that they might not be able to self-report to will fundamentally change the way that you're going to deliver care. People that suffer from Alzheimer's disease, if they don't sleep well, or seniors if they don't sleep well, are much more likely to fall. And so if you know that going in, that the person hasn't slept well, then you'll change the way that you deliver care, as opposed to if you don't know about it and they don't tell you, you're going to actually be in a reactive mode. You're going to find out that they haven't slept well, they may have some other condition after they've fallen, and then it's been diagnosed. We're trying to catch it very early in the process.
How nice would that be, not to have to go through all the rigmarole, know that you just need, you know, a better quality sleep perhaps, and meet it at the head end.
Absolutely, and what we've found through, there's many studies that have come out recently that say we're the only system that can actually take a look at and measure passively, without someone having to wear anything, sleep quality. And what has come out is that sleep quality will be one of the very first things that changes when any type of wellness condition starts to change. So we're catching the first domino that can fall in that process, and by getting that information early, again, everyone benefits through the entire process.
Fantastic. Well, thanks, Jeff. Thanks for letting us know.
Thanks for having us.
All right. Connect with WellAWARE, one of your partners in healthcare, by calling 249-2149. You can learn more by visiting their office, 5500 Cox Road, Suite K in Glen Allen, or you can visit online, WellAWAREsystems.com.